prioritizing self-care in your life. You're a busy lady. So talk to me about that.
Yes. I'm very busy. And so sometimes it's very difficult to prioritize taking care of my own self.
Yes. You're so busy taking care of other women.
Yes. So busy taking care of women. And I've learned in life, like just through my career and, just coming up, I learned that first you have to realize the importance of self-care and you have to really value it before you start to prioritize it. And I really say this because in life, we have so many tasks and we have so many assignments that take precedence. So much so that we forget about pouring into ourselves, because when we are working so hard to complete each task assigned to us, that it really becomes difficult to really put yourself first because you're trying to get so many things done. And as a nurse practitioner, I find myself always taking work home and, doing work to try to stay ahead. And also with my extracurricular activities, I'm, doing things at home to go over and beyond. And even with my podcast,
yes,
I'm always, on top of making sure I give material that is useful to women. So with all of that I do, it's sometimes very difficult to prioritize self-care. And as women, most of us, are busy taking care of home and pouring into our families, and self-care is usually placed on the back burner. And I think that self-care is so important and must be prioritized because it is our fuel. I always say that it energizes us, and it is basically our barrier that we have, that we build when we take care of ourselves. And, it keeps us mentally and physically healthy. So when we neglect ourselves and we don't take care of ourselves and we don't make self-care a priority, we do our bodies a disservice. And we also do the people who depend on us a disservice as well.
Yes.
We're into ourselves if we're not resting well, if we're not eating well, if we're not healthy enough to really even take care of ourselves, we can't really take care of other people. And that kind of reminds me like what they say when we're on the plane, we have to put on our own mask before we help other people. So that's why, self-care is so important, for ourselves and then for those who we serve.
That's a great analogy there because it's not our first nature to think that way, but we cannot be effective. You cannot go into the kind of work you do where you're pouring so much of yourself and so much of your energy into women's health, not only when you're practicing, but also in your podcast, because your podcast was inspired by what you were seeing in your work. And like, okay, I can make a difference here in my office, but I can make a broader difference for women across the world by sharing what I know and what I'm seeing, what I'm hearing from women. But that has an emotional cost to it. If you do, and so if you don't prioritize your self-care, you cannot do those things well in the way that you want to. It's all connected.
It is. It's really connected. Just like I think we'll talk about a little later, our mental health really impacts our physical health. And when we do self-care, we're really supporting our mental health. Yeah. And that's that's the reason why it's just so important.
Talk to me about confidently setting boundaries. What does that look like for you?
Listen, boundaries used to be so hard for me because I am a people's pleaser.
Yep.
Hard. I'm, like you said, one of my adjectives was that I'm compassionate. And, compassionate people tend to want to put other people first and want to please everyone. And if they ask of you, you want to be able to give and be resourceful. And that makes it very difficult to set boundaries. And I think the first step to being confident when setting boundaries is giving yourself permission to do so. Because most of us are, like I said, people pleasers. And until we realize that we are human and we do have limitations, that's the only way you're really going to be able to be motivated to set your boundaries. And when you set your boundaries, you are you're doing two important things. One, you are recognizing and you're also respecting your own limitations. And we all have limitations. No one is a woman. Okay. We all have our limits. And so when you set your boundaries, you're saying to yourself, hey, this is my limit and I cannot go beyond that. And then when you communicate your boundaries to other people, you're asking them to do the same thing. You're asking them to respect and also recognize your boundaries. And it's very important, especially when we live in a society where everyone is expected to go over and beyond, and no one is really allowed to say no. You know, we always praise that person who always says yes, who can always juggle everything, and then we don't really applaud the person who says, okay, I need to take a break and I need to rest. And I remember, I think it's Gabby Douglas, the gymnast, who kind of took a break from the Olympics during the last Olympics that we had.
Yeah.
It was a Gabby Douglas. I have to think, because I get the two gymnasts mixed up. It was not Gabby Douglas, Simone Biles.
Yes. And she, and you know, she was bold and honest about it, and people struggled with that. And when it's like, no, we should be celebrating this.
They were so upset with her because she pulled out because she developed the twisties.
Yes.
And, you know, as you know, that's basically, you know, where they have like a mind block and they forget their routine of what they're doing when they're like currently in the air. Spinning. They actually forget like how they're supposed to turn their bodies a certain way. And, you know, so that way they can land safely. And people really gave her a hard time about that. But that was her boundary. You know, she was like, listen, I need to focus on my mental health. I really don't care what you all have to say about it. Yeah. I realize that I am doing too much. The media is getting, you know, it is just getting to be a little bit much for me. This is my limitation. And I need you all to respect that. And she took the time off that she needed. And I just heard today that she's supposed to be, you know, she's back competing.
Yeah, so, I heard that too.
Yeah, so we have to just kind of follow that example, you know, and really take care of ourselves, because when we don't recognize our own limits and we don't set the appropriate boundaries, it's really not good for our physical health, and it's not good for our mental health. You know, it can bring on a lot of anxiety, a lot of depression. I've seen women who've had hypertension just because of stress. You know, it can really do a lot of things to our hormones. So it really pays to really take care of yourself and set the appropriate boundaries with others.
Yeah, and there was a beautiful intro to how emotional health, physical health, and mental health are connected. I mean, I love the Simone Biles example you used, because people are so quick to judge. I'm like, you're not the one flying up in the air that's risking your life on not knowing how to land these already dangerous tricks that they are doing out there. Not even tricks isn't the right word. Dangerous, like feats. Like, it's really hard to do what they do. And the media onslaught that those women have to deal with anyway on that. And so to have the courage, but you're right, though, we celebrate the people that are bending over backwards, but they're exhausted, you know, and all of a sudden we wonder, well, where did they go? Or why did they disappear? Or why did they have a heart attack? Why are they in rehab? What? Well, because they didn't, you know, they believe this false narrative that the culture has told us about wiping ourselves out before we step back and take a break. When it's the women and the people that have the courage to say, no more. I don't have any, I'm going to step back. I'm going to do what I need to do for me. And it's not really about what you think about it. I gotta do what's best for me. But I think women get really, they're scared to do that. There's fear and shame that if they need to take care of themselves, and we've got to strip down that. We got to get rid of that narrative.
We have to. And, not being able to say no, is the reason why so many women have like that superwoman syndrome complex.
Yeah.
Because we feel like we have to be able to please and do it all for everyone.
Yeah.
But you have to get to that point where you're comfortable with setting limitations and setting boundaries and saying no. It's okay to say no. It really, truly is. It doesn't mean that you don't care about the person any less. Mm-hmm. It does not mean that you're just not a resourceful person. Mm-hmm. It doesn't mean any of those things.
Yeah.
You do what you can.
Yeah.
And what you can do is enough.
Yeah, it's enough. I think it's so important, that enough piece. And also, you said something earlier, there's power in recognizing what your limitations are and where your space is. There's power in that. It feels like you have a choice. It feels like, you do have a choice. I think sometimes we feel so pulled and we're so worried about disappointing people or what someone's going to say or think that we feel like we don't have a choice. And it's like, no, right. Take back that choice. Take back that empowerment. There's freedom in that. And it's and you talk about, you see it every day. Women who are suffering physically because they have overstretched themselves. They're trying to live by an unrealistic narrative that isn't good for anybody. It's not good for them, and it's not good for the people in their lives.
It's not. Not at all.
Yeah, absolutely. So much power in that. And I think too, just recognizing, where am I giving, not just where am I showing up physically, where am I showing up emotionally? And what is the impact of that? Because there's a lot of, as women, as Black women, as a Black woman, as you are, there's a lot of work to be done out there. I mean, there is no shortage of work to be done and places to be active, but you've got to know when you've got to step back and just make space and time for rest, so that you can show up the way you need to, and know that you can't do everything, and it's not your responsibility to do everything.
It is not, and you should not surround yourself with others who believe that it's your responsibility.
Yes.
Those who do not accept when you say no to them, or get angry, or think negative of you when you say no because you need to take care of yourself. Those are the people that you don't really need in your close-knit circle.
Yeah.
You really don't.
Yeah. And that affects your emotional health as well. Absolutely. Yep. Such a good point. You do this so well. I mean, this is your calling, really, between the work you do as a professional and the work you're doing with the podcast, and a couple of podcasts, because you got one with your girlfriends now too, don't you?
I do. It's called Close the Curtain Podcast. And so we'll be rebooting again, hopefully next month sometime.
I love that. And I love this because it started out as an appearance once a month on the original Eavesdrop podcast. And it was called The Wind Down. And I was like, I love this. This is so much fun. You guys are just talking about things and spilling the tea on things and having just fun conversations. And it gained so much traction that it's become its own thing. So you're doing it. So you've got your work, you've got your 2 podcasts, all these things you're doing, which is why it's so important for you to take space. But it's also how you have showed up so well in supporting yourself and other women and living unapologetically.
Yeah.
At what point did you decide? I mean, I know from you and I having conversations that in talking to women that you were seeing, you're like, oh my gosh, I'm seeing these things over and over again. We have to have more open conversations. What was the point that you decided it was time for you to take that next step and do that?
To do the podcast?
Yeah.
Well, I've always wanted to find a way to reach women outside the walls of the exam room.
Yeah.
Because the problem with healthcare is that I think it's very close-minded and very one-sided sometimes. And it really depends on the provider, that you have. There are some providers that are very diverse in how they care for their patients. But what I was realizing is that a lot of women have questions that they have not been able to get the answers to, rather because the provider didn't know the answer to the question, or because they were embarrassed to talk about their concerns, or they just forgot. They just, they were talking about other things with their healthcare provider, or they were too nervous and they just forgot about their questions. Either way, I just felt that women were not getting the information that they needed, for their individual care. And I pondered and I thought about day in, day out, like, how can I help women, in a way where I have more than just 10 and 15 minutes with them. And I thought about, okay, well, let's do a podcast. Something said, do a podcast, Shalonna. And I don't know why, because I am one of the shyest people on this earth. And I don't know, why that came over me, but I felt like, okay, well, I can do a podcast and have experts come on and talk about the different concerns that I know that women are concerned about. And I started just, having a weekly episodes where I interview, women who I knew in the profession who really had the same passion as I did. So I started it out that way. And then I saw how much traction it was getting. And so I was like, oh, women are really listening. Women really want this information. And so then I started just branching out and just researching other healthcare providers that were in alignment with me. And it just kind of grew to what it is now. And I'm just so pleased at how long I've been doing it. That's I am very notorious for starting something and not having to really go as far. And so the podcast has been around for, this is its third year now.
Wow.
In September, it'll be 3 years that I've had the podcast, and I'm just proud of that accomplishment. And then I'm also, happy and excited that it has really, help women in such a big way, bigger than I ever expected, because I get messages in my inbox all the time, like, oh, this episode really hit home for me, keep doing it, keep up the good work. So I'm just excited about it, and I'm going to continue to do it. Hopefully it'll lead to other things that will benefit women as well.
Absolutely. Well, it's really remarkable. It's really wonderful. It's so well informed. You touch on so many topics within health, within women's health, emotional health, mental health, physical health. You make that a priority, and you have such compelling people on, and there's such compelling conversations, and there's so much, I think, that empowerment to women and being informed. It helps women know. I mean, there's so many, I've listened to so many of your episodes, and it's like, oh, I never thought about asking that. Oh, it's okay to ask that. Oh, that's what that means in my body. Oh, here's a woman who's also a medical health practitioner who understands what is happening to me. She sounds trustworthy, maybe that, because I think sometimes too for women, if you've been burned by an experience, or you've had a bad experience, or you've felt shamed, you're really resistant to either asking that question again or going back to that provider. And I think you provide such a welcoming and informed space that can really make women feel safe. And in going back and finding that person that can help them in person, because this doesn't take the place of going to the doctor, and you're very clear about that. You've got a whole you cover that very well. But yes, you have to. That's very important. But you also, I think, have just such important conversation. There's so many things in our health and our bodies that we don't want to talk about because someone has told us it's not appropriate, or if there's been such stigmas and shame around it. And you open the doors to all of that. As, when it comes to knowing our bodies and knowing how we feel and what's going on with them, so we can articulate that and not having shame wrapped around that. And you talk about that on so many fronts, and it's so important, and it's so It's badly needed. And I think when it's coming from you, you have a position of authority because you bring a scientific background,
right,
combined with your compassionate background.
Right.
And I'm not surprised the response has been what it was.
Yeah. And I made sure that I put other things other than just physical
Yes.
in there, because I am a firm believer, as we talked about earlier, that our physical health, our mental health, our social health, like the people who we've invited in our lives and allow in our circle, in our space, even our economical health, all of that is intertwined and affects our overall physical health and how we're doing. So my topics, I definitely will talk about gynecological subjects and topics, but then I look at other things that women may come across that may affect their overall health. So we talk about relationships, we talk about mental health, we talk about even the social things that's going on in our world today, which is why I did the wind down, because we talked about a lot of common things you may see on the news. So all of that, I think, just really affects us altogether.
Yeah. And relationships. I mean, your whole doctoral work was so impactful on women feeling safe if they've been in abusive relationships, on where to go and what health practitioners need to be looking for within that. Like, this isn't just a physical appointment to check her blood pressure and her heart and do the, yearly pap smear and all this. There's more to this than that. How is she doing emotionally? Are there any things that are coming up? And that's so powerful and so important.
Yes.
Because, as practitioners, you're going to see things that other people don't see. But, and seeing that connection. Oh, my gosh.
Yeah. And that's why I did my doctoral project on domestic violence and educating providers and coming up with a protocol that helps providers not only screen their patients, but gives them guidance on what to do once their patient has admitted to being abused. Because oftentimes I think a lot of us shy away from asking those questions because, one, we don't know how to approach it.
Sure.
And secondly, because we don't know what to do. If it's kind of like open up a can of worms or Pandora's box.
Yeah.
Asking the question. So now she's telling us, okay, yes, I have been abused. So what are you going to do about it? And so many doctors shy away from that because they don't really know what to do after there has been admission to it. So I developed a protocol, which we did do in the practice where I worked. And we're currently still using the protocol to help screen women, because I feel like the first line of defense is usually the healthcare provider. Most women will come in for their annual appointments, or they'll come in for problem visits throughout the year. And we should be asking the important questions, and we should be able to be resourceful for women if they're going through these things.
Yeah. Yeah. I think that's so important and so powerful, because I think sometimes what happens is we see a physical manifestation of something. You talked about hypertension earlier, that can just be, or anxiety. Okay. What is there something chemically going on? Oh, and if so, what's inducing that? Is there asking the question, is there something else going on in their life that's inducing this thing, and not just jump to the conclusion that, this is something they have in their family, here's a pill. And it's like, actually, it's deeper than that. And I think you approach that and you look at that whole thing, and that's so powerful.
Yeah. And a good example of that is one day I was watching a TED Talk, and this OBGYN, I forgot her name, but she practices in New York. And I will never forget this story, because it just shows like why looking at the total person and not the illness is so important. We had a patient that had chronic pelvic pain. She had been to several doctors, had so many diagnostic studies done, and no one could really determine, why she was having this pelvic pain.
Yeah.
And so the patient or the woman ended up in her practice. And at her practice, it's common practice for her to screen her patients for depression.
Okay.
All providers are required to do it. Some offices do it, some offices don't. Some do it, but then don't really read the questionnaire. But she's into research, and she's into studying about depression and anxiety as well, and how it affects gynecological health. That was her background. So of course she's taking this a little bit more seriously than, some providers may be.
Sure.
And so she gave the woman the questionnaire. She filled out the questionnaire, and her depression scores were just kind of like it was just out of range.
Wow. Just off the charts.
It's off the charts. And she ended up, talking to her, just about the depression. Was she ever diagnosed? She said no. Was she ever taking any medications for it? She said no. She just spent time just talking to the woman about it. And then she ended up not even doing anything, ordering any ultrasounds or anything like that, because she had already done all of that. She just sent her to a therapist in psychiatry and got her the proper medication and help that she needed. And that pelvic pain disappeared.
Wow.
Pelvic pain disappeared. There are a lot of research studies on how pelvic pain can be strongly linked to trauma, especially sexual trauma, and also depression. And we don't think about that because we're thinking about the pelvic pain. When a woman comes in and complains about pain, we're thinking about the pain, and we're not really taking into consideration everything that might be going on.
Yeah.
So that's why it's so important to just look at the total picture and look at the person holistically and incorporate everything about that person into their care.
I love that. That's such a powerful example. Thank you for sharing that. Ladies, remember these things. Remember these things. And it's okay to demand these things when you're seeing your practitioner. If you don't feel like you're getting that help, look for other places to go, because there are doctors and practitioners like Dr. Shalonna Battle and like this woman, and they're out there, and you have a right to find them and have them. So thank you so much for that. The importance of setting and coming back to your why and your values in everything you do. So your values, your compassion piece really played a role in all that you do. It's very clear by your work, but talk to me about your values journey. Has that always been the case for you? Is that something you've come to know about yourself?
So I definitely value health. I've always valued health coming up, even before I became a nurse, before I even went off to college. I knew that I wanted to do something in healthcare. I always knew that. When I was young, I wanted to do psychology, and I don't know why. When they ask you, most kids are like, "Oh, I want to be a doctor. I want to be a lawyer. I want to be an astronaut," and I'm like, "I want to be a psychologist."
Just the 8-year-old.
But, and of course I didn't end up being a psychologist. I actually studied psychology early on in undergrad and totally hated it.
Oh, wow.
Because I was like, this is just not for me. And then I ended up in nursing school. But I always knew that I wanted to be somewhere in healthcare because I value health. I think it's very important, because without health, you really don't really have a quality of life. And that's something that I really definitely value. So basically just why I just value health, and I value helping others.
Yeah.
That's something that I've always, wanted to do. And I think I get joy out of it, and helping others has actually helped me, grow as a person as well.
Yeah.
So, yes.
Absolutely. Well, and you're a difference maker, and it comes through in your work. So thank you so much for that. Living out of your own expectations versus others. Talk to me about the expectations journey. So for you yourself, and also I'm sure this is something you see every day with women.
I think living our own expectations and not the expectations of other people is so important, because I feel like most of the time when people place expectations on you, they want you to live by their values, their ideas and their customs and how they were raised.
Yeah.
We are not all cut from the same cloth. We're not the same. Our values are different. How we think, how we feel, is very different. And as we are growing and we're learning to accept ourselves for who we are, I feel like living out other people's expectations, especially society, it will continue to take us down a rabbit hole of imposter syndrome, comparing ourselves to others all the time, and doubting our own abilities.
Yeah.
And so, when this happens, it's hard to grow into who we are.
Yeah. Really? Have you always had a firm grasp on that, or is that something you've had to learn and grow into?
I had to definitely learn it, because, I feel like we all, coming up, our parents have expectations on us.
Sure.
People in our family, they expect us to do X, Y, and Z. They want us to go off to school. They want us to do this and do that and be great people and great citizens, which is great. And we all should. But sometimes we get caught up in living out what they want for us and living out their desires. And we just don't stop and consider what we want. So I had to learn how to kind of break away a little bit from what my parents wanted me to do.
Yeah.
And what they expect of me, and just kind of be my own individual person. They set the foundation, early on.
Sure.
It was time for me to kind of blossom and grow and just kind of live out who I am, live out my truth.
Yeah, absolutely. Yeah, so important. And that can be tricky too, because sometimes when you move, because a lot of times our parents mean well. It doesn't come from a place that's meant to do any harm, but it's still that, okay, I got this now, everybody. So I'm going to move in this direction, and I hope you'll move with me. I appreciate the foundation you gave me, but it's time for me to find my own path and my own way.
Yeah. And I think that's the way it should be. Coming up, when we're young, we don't really have, that sense of direction. Our values are still developing, our morals, we're still learning, at that age.
Yeah.
So our parents are there to guide us and set that foundation for us.
Right.
But at some point, you have to set the standard for yourself, and you have to set the expectations for yourself. And I think we get there. And I think the foundations and stuff that we have coming up just guides us into, what is next for us in life.
We'll talk about, you've been just a little bit earlier, but accepting the layered aspects of ourselves, all the parts of us that make us who we are, and not just the shiny stuff that we see on, social media or in the pictures and stuff, but all those pieces and all those parts of our journey. Talk to me about your layers journey.
Ooh, my layers journey. That's, learning to accept the negative things about you, because not everything is going to be, like you said, shiny.
Yeah.
And definitely coming up as a young girl, it was hard to accept all of my flaws. It was hard to look in the mirror sometimes, but as I got older, I learned to accept some of the things about myself. And as I continue to grow, I learned to accept all of the things that about myself. So it was a process. And I'm glad I'm at a point now where I'm able to accept all the great things, all the bad things, and also all the ugly things, because I feel like everything, all of those layers together have made me who I am today. All of those things together have got me to where I am today. And I don't think I would have gotten where I am had it not been for those different layers.
Yeah, 100%. And I think too, for me at least, and I'll be interested to hear what you have to say on this, sometimes accepting those harder things, those ugly things, those things we don't want to talk about, can also inform our ability to be compassionate and empathetic to others. You know, if we can accept those things about ourselves, I think it allows space to be more empathetic. Has that been your experience?
Yeah. It definitely has been my experience, because now I'm able to talk to women who have been where I am, where I have been, where they're not accepting certain things about themselves, and I'm able to relate with them or relate to them because I've been there.
Yeah.
And I think that when we live in the era of social media, we live in the era of like a society that, you know, just glamorizes perfection.
Yes.
It's really hard to just be accepting of our imperfections.
Yeah.
You know, and it takes work. It takes a lot of work to get there.
Yeah, absolutely. Yeah, and a good point on that. Glamorizes, and it's not realistic. No one measures up to that. No one lives up to that. It's not a sustainable, true model. And so, you know, being able to accept that part too, and see the part, you know, none of us do. It doesn't matter. You know, what you see on the surface can be deceiving. And so just know that that's not the case for anybody, and not, you know, realistic for anybody. But yeah, that ability to, I think, to relate and connect just opens up when we're able to do that. In living out feel, in finding empowerment, embracing layers, which is the name of the podcast, but in living that out in your life, how has that affected the quality of your relationship with yourself as well as your relationship with others?
I think that when you learn to embrace your layers, you learn to appreciate who you are. Your self-esteem improves. Your sense of self-worth improves. When you're able to accept everything about yourself, and when you feel good about yourself, it's easier for you not to allow people to come into your life who aren't supposed to be. Yeah. It's easier for you not to accept negativity. You know, I feel that we're able to make better decisions about the people who we allow with us in our circle. Yeah. And so I feel like embracing my layers have really helped me. You know, it's really helped me in a way not to allow negative relationships.
Yeah. Because you know you're worth more. You know you deserve better, you know? And I think that also opens the door to prioritizing yourself and your self-care and your health, because you know you're worth more. Yeah. All those things work together. So yeah, really, really good point. Thank you for sharing that. So that's a great takeaway. And like, you know, it's all connected. It's all connected. It will mirror each other. We are down to our rapid fire. Name 5 activities that nourish you.
Sleeping.
Yay! I don't know when you sleep, but I'm glad you value it.
Exercising. Definitely spending time with family. Spending time with my family is definitely something that grounds me. Praying and meditating and listening to music.
Very good. And 5 words in how you want to feel the next 6 months.
Relieved. Because there are some things that are going on right now with me, like some big decisions that I have to make. And just the whole process of making these decisions and thinking about it has been giving me a little bit of healthy stress. I won't say I'm stressed out, it's healthy stress.
Sure.
So I think within 6 months, these decisions would have been made. I will be relieved.
That's great. Good stuff. It's like
accomplished. I know I've already accomplished, getting my doctorate degree and working in my career, but there are some other life goals that I have for myself. And one is starting my own telehealth business, which will be up and running by the end of, we're at the end of the month, but at least by the 30th, I'm hoping to be finished with everything to do in order to get this up and running. So I have a couple of days. There's 1 or 2 things that I need to do, and then I'll be ready. So by in 6 months, it'll be a thriving business.
Yes. That's exciting.
I'm so excited. I'm I'm scared too.
Yeah.
But there's more excitement than there is fear. So just gonna put my best foot forward.
Yeah.
And so decluttered. Decluttered is another word that I hope to have accomplished in 6 months. Because, like we spoke about earlier, about all the things that I do and I'm into, I'm to a point now where I feel like I need to start prioritizing some things and letting some things that aren't priority go.
Yeah.
And I'm in the process of, and that's where it goes back to relief, because it goes back to making decisions.
Right.
So I'm in the process of just trying to declutter my schedule and, declutter my mind.
Yes.
All that stuff.
Yeah.
So I'm in that process.
Okay.
And then also in 6 months, I want to continue to feel loved. Loved by family, loved by friends, loved by my patients. And so that, and then also alignment. I want to be in alignment in 6 months with, I guess, more in alignment with what God has placed me on this earth to do. I know I'm serving my purpose, but I feel like there's more ways that I should be serving my purpose. And I just want to be in alignment with my assignment.
Yeah, absolutely. And we know, I think that's such an interesting point. We know that, we can feel it in our souls and in when that needs to be aligned. And so, having the courage to follow that, I'm super excited about the telehealth. Will that be just within your state, or will that be something that you'll do broader?
Right. So the Perfect Harmony Women's Health Telemedicine, that's the name of it.
Okay.
It's just within the state of Florida right now, because that's where I'm licensed.
Sure.
Once I have licensures in other states, I can open it. Which I hope, to do at some point.
Sure.
In 6 months. But right now, it's just in the state of Florida, and I'm offering just basic telehealth services for most things where women don't really need to be in the office for.
Okay.
And then I also offer coaching services for women who do not live in Florida. So for women who want to manage their symptoms of menopause and polycystic ovarian syndrome and PMS naturally, I have a coaching business for that.
Yeah. And all those sources will be in our sources doc, folks. So don't you worry. Go to embracinglayers.com. It'll be on our website. It'll be there. And I'm super excited because by the time this drops, it's going to be real close to some of these things come into fruition for you. So the timing of this is going to be really exciting. Wow, that's a whole other avenue that I'm so happy for you for. And I'm just so thankful for the work you do in the world and the difference maker that you are, and that I get to know you and share you. It's just such an honor, and I'm so thankful for you and for people like you that are willing to to be that catalyst and be that advocate to help women with these very important things that are going on every day, that they need to know if there's somebody out there that's safe, that they can trust, that's going to give them good information.
Yes, I agree. And that's what I intend to do. Like I said, I feel like I know my purpose and I'm walking in it, but I really feel like there's more to do. Yeah. There's more work that has to be done. And I am committed to getting the work done and just fulfilling my mission.
Yeah. Well, you're doing this beautifully. And I'm so excited to get to watch this. And I'm so thankful that I've gotten to meet you and have you part of my circle. You're such a blessing. So stay tuned, people. Dr. Shalonna Battle's out there making moves and doing things and continue to live out her purpose and help and be such a wonderful and beautiful resource in the world. So again, go to embracinglayers.com, check that out. Thank you for joining me this evening. I'm so appreciative of you taking the time. Your time is precious and valuable, and it means so much that you took the time to share yourself and all you do with our audience tonight. But so thank you.
Yes, thank you for having me.
Absolutely. It was an honor. All right, Field Podcast audience, you heard it. Sources, go check out what Shalonna does. She has a lot of great information on our website. Check out the Eavesdrop podcast. Oh my gosh, so good. So much good information. Start from the beginning and go all the way through. It's all really relevant. It's all really important. Absolutely. I'm so glad to get to share that. Go check out all those resources. And don't be afraid to ask those questions. And know there's somebody out there that wants to help you with that. But take care of yourselves, ladies, and have a great week.
Goodbye. Thanks for listening.